Okay, so we are live on YouTube.
Okay. Good evening, Dr. Deepmala. Thank you for joining us. Good evening, Dr. Gautam. Thank you. Thank you. Right. So, Shmit, it's 4 o'clock.
Yeah, we can start.
We should start now. Thank you.
Yeah. Hello, everyone. A very good afternoon to all of you. Bhargav Lab welcome all respected doctors, senior interns, and students to the iSampark webinar, which is a CME initiative of Bhargav Lab sponsored by Spondent Drops. My name is Ishmeet, and I'm the senior product manager. With me, we have our marketing manager, Mr. Rajneesh Negi, with us. So, in today's iSampark webinar, we are presenting on a topic which is understanding ADHD and its homeopathic management. And to talk on the topic, we have Dr. Kavita S. Chandiramani from Mumbai. She is a practicing homeopath since last 10 years. She's practicing over there in Andheri, Mumbai. She has completed her post-graduation in pediatrics and holds special interest in treating pediatric cases. She has also presented many cases amongst homeopathic organizations and seminars pan-India. And she has been authored to many articles published on various different platforms on homeopathic approach, and she has also organized several homeopathic community awareness program. So Dr. Kavita, we welcome you to the iSampark webinar as a speaker. Before we start with the session, we would like you all to go through a brief corporate introduction to know what Bhargav Phytolab is. Then we will have the topic by Dr. Kavita. In the end, we will have question answers. So talking about Bhargav Phytolab, we were established in the year 1920. So this year we are celebrating our 100 years journey in serving homeopathy across the globe. Today, Bhargav Phytolab is not only in India, Bhargav Phytolab is also present in around 34 plus countries. We have our own manufacturing plant, which has state-of-the-art technology based at Bhiwadi, Rajasthan. We produce more than 3,000 plus products and have got really strong quality assurance, regulatory and quality control department to ensure the good quality products. We are also the number one anti-contaminant homeopathy medicine manufacturer, which is basically we have got 45 air handling units at our plant, which ensures zero level of contamination in any part of the unit. These are the products, or this is the range that we manufacture: mother tinctures, dilutions, biochemics, biocombinations, single remedy trituration tablets, gels, homeopathic complex tablets, drops, ethical tablets, oral care products, external oils and gels, pellets, and food supplements as well. And these are the countries wherein we have our own presence. In fact, in 11 countries, we have our own registered offices as well. Talking about our 100 years journey, as to celebrate the 100 years of journey, we have initiated many good initiatives in the first time in homeopathic field. One such initiative is the iSampark webinar, wherein we have conducted more than 65 webinars in last 3 months. Webinars are being taken on different topics and is basically for the scientific development and upliftment of homeopathy. We also conduct Facebook live session for the awareness of mass population, general public on different topics with doctors as well. Bhargav Phyto Lab salutes Corona warriors, especially the doctors who have gone ahead and served the nation in this tough time. We have also come up with the first online digital platform with the name GoDoc, which is exclusively for homeopathic doctors. It is a platform which will enable you to consult to the patients digitally. We also have a book series with the name Beyond Practice, which is our quarterly magazine for continuous medical updates of the doctors and interns. We have also come up with an initiative with the name Homeopathy Works. This initiative is basically wherein we would be presenting case studies on bones and related disorders on the occasion of World Arthritis Day and World Osteoporosis Day, which is celebrated in the month of October. So in case you have any case that you have treated successfully with these bone and related disorders, so you can share it with us. We would be happy to publish that case study and article. It would be shared with all the doctors pan-India with more than 10,000 plus doctors. A few of our leading brands and the sponsored brand for the event is Spondin Drops, which is for neck and shoulder pain. Spondin is the trusted #1 brand and most trusted by homeopathic doctors. We also have OsteoStrong, which is for bone disorders like osteoporosis, osteopenia, and decalcification. OsteoStrong is for stronger and healthier bones and contains 4 bone strengthening ingredients. OsteoStrong is available in delicious orange flavor, which makes it an excellent option for all age groups. So not taking much time now, I would request our speaker of the day, Dr. Kavita, to please take over the session and share her screen. Dr. Kavita, you need to unmute. Yeah.
Yes, thank you, Ishmael, for such a wonderful introduction, and good evening to all the participants. Good evening, Ishmael. Good evening, Rajneesh. And thank you for giving me this opportunity to come on this platform and share my understanding on ADHD. So I'll quickly share my screen. Rajneesh, you'll have to help me with this.
You need to just open your slides now. Your screen has already started. We can see the screen. Yeah.
You can see my desktop, right?
I can see, yeah.
Yes.
Okay,
yeah, it has come. Yeah.
It's there now.
Yeah?
Yeah, perfect.
Okay, thank you so much. Good evening once again, and I'm so impressed with what Bhargav Phyto Lab is doing by connecting so many young homeopaths and giving them an opportunity to present their cases, to share the deeper understanding of homeopathy with all of us. You know, this pandemic has definitely brought us together, is uniting us together, and expanding our homeopathic family. I'm so happy that you've been organizing so many webinars. You know, 65 is a huge number, and I'm so happy. Right from senior practitioners to students are thoroughly enjoying, and again, unity in diversity is what you guys are doing. Thank you so much. Let's begin with understanding about attention deficit hyperactivity disorder and its homeopathic management. So before we begin, a tribute to our master. I am today successful in my 10 years of practice because of 5 important people. One is our master, Dr. Hanneman. Second is my mother, who is a practicing homeopath since 38 years, Dr. Pratima Shah. My 3 teachers, Dr. Rahul Joshi, Dr. Devarika Sir, and Dr. Kritik Shah, who have given me such a vast knowledge about this subject. So let's begin with the Hahnemannnian oath. I request everyone to take this oath. On my honor, I swear that I shall practice the teachings of homeopathy, perform my duty, render justice to my patients, and help the sick, whosoever comes to me for treatment. May the teachings of Master Hahnemann inspire me, and may I have the strength for fulfillment of my mission. So let's begin. Just adjust my screen. Yes. So coming to ADHD, which is a behavioral disorder characterized by inattentiveness, impulsivity, and hyperactivity. So nowadays, we commonly come across mothers saying, this is a very common fact statement that my child is very hyper, my child is very active. And Google nowadays, patient will always come with all Google details with you. And the mother and the father will only diagnose the child and come with a condition that, "Arey, mere bachche ko ADHD hai." But no, we as physicians play a very important role to differentiate between an active, inquisitive child and a child with ADHD. Look, kids nowadays are naturally active and inquisitive, power packed with energy, some more than others, but this is not a cause for concern. This could be a normal part of their childhood development or their personality development. But if a child's teacher or if the child's daycare provider points out some differences, some problems in a behavior of a child, it is worth taking a closer look at it. And one of the main differences between a normally active, inquisitive child and a child with ADHD is that the disorder interferes with the child's function, with a child's day-to-day activity, and even the social compatibility. So as a physician, we need to take a detailed, a thorough history, even deep into the family history, because ADHD tends to run in the families. A detailed questionnaire has to be provided to the parents, has to be filled, and observation is very, very important to diagnose ADHD. Coming to the types of ADHD, there are 3 types of ADHD. One is the combined variety, second is impulsive or hyperactive variety, and the third is inattentive or distractibility. In our day-to-day practice, we commonly come across with the combined variety of ADHD, which includes both impulsive hyperactive as well as inattentive behavior. Let's quickly run through the causes and risk factors. So low levels of dopamine have attributed to causing ADHD. Even premature birth can risk causing ADHD. Maternal drug use or alcohol or smoking during pregnancy. Genetic factors, as I told you earlier, ADHD runs through the families. So a child with ADHD has a 1 in 4 chance of having a parent with ADHD. Even exposure to environmental toxins like lead can attribute to ADHD. Here, I would like to clarify one thing, that a lot of kids are now glued to screen time or video games. But let me tell you, friends, there is no such evidence that excess of screen time or excess of video games can trigger or can cause ADHD. Also, I would like to clear that using candies, the sugar candies, or the flavored or processed foods, a lot of parents ask, does this cause ADHD? Yes, it definitely causes sugar rush in children, but there is no evidence yet to prove that candies or processed or flavored foods can cause ADHD. Coming to the symptomatology, the etiology, it is as noticeable as 3 years of age. ADHD can be mild, moderate, or severe. ADHD in childhood may continue in adulthood. So here comes the importance of early diagnosis of ADHD, and we as homeopaths can offer a very promising treatment to ADHD. And earlier the treatment, better the prognosis. Diagnosing early gives us a good prognosis, helps the ADHD child to be more successful in his school, in his social relationships, and also for his future. It helps to build up relationships, whether it is emotional or social bonding. So children with ADHD struggle with a little bit of low self-esteem, troubled relationships in their adulthood, and even the children have poor performance in school. So early diagnosis would help us to treat quickly, and symptoms wear off at a very early age and do not continue in adulthood. Also, ADHD is more common in boys. Coming to the symptoms, this is very interesting. There are two categories. One is hyperactivity and impulsive behavior, and the second is inattentive behavior. So coming to the hyperactivity and impulsivity category, ADHD kids are very interrupting. So they would just butt into the conversations, or if there are kids playing game, an ADHD child would just butt in and wait for his turn or wait to play, even interrupt in conversations. They're always on the go. They cannot sit at one place. The best ADHD child example would be a play school or a nursery, where you will observe that these children cannot sit at one place. They would always be doing something or the other, like stacking the books, stacking the toys, opening the compass box, playing something with the crayons, with the pencils, with the glue, with the colors all over. Cannot wait for their turn. This is noticed by teachers, and this plays a very important role for our homeopathic case taking also, because this is commonly seen again in a classroom type of behavior, where a teacher gets some new activity, for example, some origami or some painting, and an ADHD child will first rush to the teacher saying that I am going to do it first. They're very fidgety. They will keep playing with the pencil, with the crayons. They'll open the compass box, shut the compass box, open the book's pages, again, shut the book. So this is also very commonly seen with ADHD. They have trouble playing quietly. This, I would not consider it a very, very important symptom, but because nowadays all kids, ऐसे कहते हैं जब शोर रहेगा तो बहुत मजा आएगा घर पे, and this is what happens with kids. So I would not stress too much on this symptom, or I would not include this in my questionnaire. The last symptom in the category of hyperactivity is an ADHD child blurts an answer before the question has been completed. Very commonly seen. Coming to the second category is inattentiveness. An ADHD child tends to make a lot of careless mistakes. Now, this is not due to laziness or lack of intelligence. It is only because these kids do not follow instructions. Intellectually, they are very smart, very talented kids. A lot of forgetfulness and losing things behavior is seen, especially told by mothers. I'm so sorry. Yeah, especially told by mothers that they would lose their pencils, their crayons. They would forget doing their homework also, because ADHD children do not like to do any mental work. They have a lot of lack of attention in any task or play, and they cannot finish off a task. They cannot complete a task. This is again a very important symptom of ADHD. They avoid or dislike tasks that requires focused mental effort, like homework. So these kids never come home and say that aaj teacher ne ye homework diya hai, and they would always want to run away from mathematics, run away from finishing their classwork books or their homework also, and cannot focus or cannot stay on any task. Coming to the next very interesting slide is the coexisting conditions with ADHD that we come across. Conduct disorders like stealing, fighting, destruction, harming people or animals. A lot of learning disabilities is seen, like dyslexia, dyscalculia, or dysgraphia with ADHD kids. Substance use disorders commonly seen in youth, when childhood ADHD runs through in adulthood also. A lot of anxiety disorders, mood disorder, very commonly seen in OPD practice is ADHD with ASD, that is autism spectrum disorder. Even we come across tic disorder, but not very common with ADHD. So let me tell you about management. It is a teamwork. I always believe managing challenging cases, tough or difficult cases, always requires a teamwork. So a total medical evaluation by a psychiatrist, a psychologist, and in a few cases by a pediatric neurologist is very, very important. Homeopathy, yes, offers a very promising and a very important role in management of ADHD. We will also require a psychologist to assess the child periodically, to counsel the patients, timely assessment by school teachers. So the report card is of utmost importance for us in case taking. And then coming to occupational therapy, which will help a child to do the basic chores. This is an abbreviation given by Dr. Ram Subramaniam. He's a leading pediatrician in the eastern suburbs of Mumbai. So he says that occupational therapy should help a behavioral disorder child with BMT-BDB. You can note down BMT-BDB. B stands for brushing, M is milk, T is toilet, B is bathing, D is dressing, and B again is breakfast or maybe their lunch or dinner. So an occupational therapist would always target on choosing therapies to make a child independent to perform his day-to-day basic domestic chores. And as I mentioned earlier, prognosis is good if understood and treated early. Now, coming to the homeopathic management, to become a successful homeopathic pediatrician, you have to be a very keen observer, very soft, very gentle, and very caring with pediatric set of patients. As soon as the child enters, you need to comfort the child. You need to have a very friendly approach, a very friendly attitude towards the child. Try keeping some toys also. We all are known as the Meetha Goli Wala doctor. So as if you have toys, that would be an additional benefit for
Good one.
yeah, we'll have an additional benefit saying that, oh, ye doctor ke paas to khilone bhi rehte hain, meethi goli, like they say the white chocolate. So meetha goli and toys, it's going to be ek pe ek wala offer. So this keeping toys and most important is when you keep toys in an OPD, you will be able to observe the child's behavior in a more deeper manner. You will be able to interpret his behavior. You will be able to interpret your observation also. And kids with behavioral disorders, if you see their parents, they have a lot of anxiety issue. So very important as a physician that we need to allay their anxiety. We need to reduce their anxiety by counseling them time and again with every case taking, with every follow-up, especially during the first case taking. So avoid questioning the child in the beginning of the case taking. Do observe the child, and as soon as the child starts getting friendly, you can start befriending him and then showing them the Meetha Goli and then observing more of his behavior and asking questions. So the crux of a pediatric case taking also depends on the knowledge, or you can say that a thorough details of the stages of development, whether it is physical, whether it is emotional or social development, has to be known. Which stages, which the child, if this is normal or this is abnormal. I would recommend everyone to read in details the psychology, the psychological development in kids. Very important as a homeopathic physician to even observe, to be a keen observer and to interpret the observations correctly. And as I said, assessment of school teachers is very, very important. It gives vital clues for our case taking. Let's go to the next slide. Let us all be very unprejudiced. These are just the drugs which I have used in my 10 years to tackle ADHD. But I reiterate, a thorough case taking, analysis and evaluation of the symptoms repertorization, and then coming to a group of remedies and going back to the source books and having a comparative materia medica study is of utmost importance. There will be many doctors, many seniors coming and presenting cases, their approach, but this is the standard principle. And let me tell you, if you follow this, you will be a successful homeopath. You will never have any problem with case taking. And a well taken case is half cured. We all know this. So, coming to the groups which I've commonly used in my 10 years, Calcaria group, Chamomilla, Cina, Mercsol, TUB, Lyco, Verat Alb, Tarentula, and so on. We'll quickly run through the remedies. We all know these deeper constitutional acting medicines. We'll quickly brush through our favorite remedies in ADHD. So Calcaria Phos, very delicate, tall, thin, scrawny with dirty brownish skin. They have a lot of restlessness. So when they are at home, they want to go out. And when they are out, they want to go home. And they want to keep going from one place to another. They have a 3-mark desire to travel. They have aversion to school because a Calcaria Phos child does not like any mental task. And we all know that school-going headache caused in Calcaria Phos child is because of aversion to any mental task or because of mental exertion. And Calcaria Carb is indicated in school children with headache due to physical exertion. Also, we know that Calcaria Phos has delayed milestones like delayed dentition, slow learning to walk, even delayed closure of fontanelles. These kids cry a lot in sleep and they are very peevish and fretful, and their complaints aggravate by thinking about complaints. Coming to the next favorite remedy is Chamomilla. These children are with light brown hair who are of an irritable temperament, very capricious. They themselves do not know what they want. The child whines and cries and wants something new every minute. So if they are given some particular thing like a toy or something to eat, they would just throw away in anger. They are so snappish, they are so cross, they are so uncivil and very quarrelsome with other kids. Very commonly seen is that Chamomilla kids omit words while writing and speaking. They even have problems in reading. I have a very interesting case where a child's dyslexia improved with Chamomilla as a constitutional medicine. So mental calmness, we all know that contraindicates Chamomilla. And another very close drug to this is Cina. So let us go to Cina, very commonly known as worm remedy. So ADHD with worm infestation, you can think of Cina when your entire totality matches Cina. So Cina is suited to children who are fat, rosy, scrofulous, marked touchiness, physically and mentally. They do not want to be touched. They do not want to be carried. And physical sensitiveness or physical touchiness is more with sensitiveness in skin, sensitiveness in skin of hands, feet, sensitive to touch also. They have a lot of desire for sweets and indigestible things. We all know this. And they're aggravated by being looked at from seeing strangers. They have a lot of temper tantrums. And the best Cina child to observe is in a mall when they want this, that, but when they are given, they refuse, they throw loud tantrums, and the parents feel a little guilty. So the best Cina child to be seen is in a mall or just outside a toy shop. So Cina children also refuse going for a haircut. And this I can tell you with a case of mine, which I'd seen around 5 years ago, that he would just see the salon and cry. He would just see the salon and cry. And when a few doses of Cina were given and a lot of counseling to the child was done, important to, I gave him a lot of logical reasoning why his hair needs to be cut, why he needs to keep his hair hygiene. And a few doses of Cina helped beautifully. And now he loves going to salon for a haircut. That too, he wants a particular person to do his haircut with some nice, smart cut. Very important, again, observation in Cina is that a child sleeps in a knee-elbow position. Coming to our next favorite drug is Lachesis, a very deep and long-acting polycrest remedy, very, very suitable in ADHD. Great sensitiveness to touch all over the body, cannot even bear the touch of clothes at times, and great desire for fanning slowly. And Lachesis child is brought by the parents for behavioral and emotional problems, typically after birth of a new baby in the family, which leads to tremendous jealousy towards the sibling. This is again very commonly seen in a Hyoscyamus child. So these kids are very smart. They play tricks on teachers. If you see a ADHD child of 8 to 9 years, they would just, when the teacher is turning to write something on the board, they would just hit with a chalk. And these are the kinds of tricks they play. Tricks to even avoid homework, to even avoid classwork. They're very abusive kids. They time and again insult their parents. So swearing is commonly seen in Lachesis as commonly seen in Hyoscyamus. Very loquacious kids. They love animals and cats. A lot of difficulty in concentration. They are not able to finish their task also. Even their day-to-day routine. And very uncommon to see religious affections in children, but very commonly seen in a Lachesis child. So jealousy, sibling rivalry, and suspiciousness is the hallmark of Lachesis. Coming to our next drug, which is Hyoscyamus. The basic disturbance in Hyoscyamus is jealousy and suspicion, and even suited to children who feel neglected by mother after the birth of a new baby. So this points towards the jealousy. In comparison to belladonna and stramonium, Hyoscyamus is a little more passive, less violent, not as violent as bell and stram. He has very poor control over his impulses. So he keeps talking, he keeps joking and throwing tantrums, bites everyone who disturbs him. Again, this is noticed by the class teacher. And when a parent tells you this in a case taking, please note it down because this is of utmost importance. They have a great desire to break things. Antics play, very commonly seen in Hyos. They have a desire to uncover, destructive, malicious, and a very artistic aptitude. If you see a Hyoscyamus child, they will show you beautiful paintings, beautiful craft, origami, beautiful art. Also, in my OPD practice, I keep some drawing books and colors. This definitely shows the artistic aptitude. One, that is that the child is away from screen time and doing something very constructive. And at the same time, a physician can observe their behavior. So if this works for you all, I would like to share that do keep some toys and some colors and drawing books in your OPD. Helps a lot with pediatric case taking. Coming to the next drug is Tarentula. Like a spider, cannot sit in one position, cannot cease, has to keep moving. Constant restlessness is the hallmark of a Tarentula child. Like a spider, very restless, constantly in motion, irregular movements, breaks, tears, and throws things. So with Tarentula, the violence is directed towards himself. He would self-injure himself. He would go and bang his head. He will just pull out his hair. And in case of stramonium, to differentiate between Tarentula and stramonium is more into breaking objects, or the destructive behavior will cause a lot of harm to others, to parents, to grandparents, to friends. A Tarentula child laughs, mocks, runs, dances, gesticulates, jokes, cries, sings till exhausted, rolls on ground side to side or strikes vehemently, also called as a Popeye baby. So as even a Tarentula child is very commonly seen in malls. So Cina, Chamomilla, Tarentula. It's so nice to be a homeopath. Whenever you are in a public place or whenever you are out, I'm not talking about the prejudiced behavior, but it's so nice to observe kids, even adults at times, but it's so beautiful to observe kids and, say that this could be a calcaria car baby, this could be a Cina baby, this could be a Hyos baby, this could be a Stram baby. I do this quite often. But keeping that aside, it's just for fun. It's nothing to do with labeling a child or saying. It's just to understand the drug in a more detail and depth. Coming to the next drug is Tuberculinum. Very chilly patient, very chilly child, suited to children with light complexion, narrow chest, who are mentally active and precautious. Again, restlessness in TUB is more for desire to wander. They are very sensitive and worse from music, very obstinate and disobedient. They are indifferent to punishment and reprimand. In TUB, we would see a lot of unpredictable mood and behavior. So, one point, they are very gentle, very refined, very obedient. And at the next point, you would see the same child being very malicious and destructive, very commonly seen. Even in OPD, they would be just quiet, nice, very gentle, and all of a sudden they just throw a tantrum. Very peculiar behavior of TUB. They are never satisfied with anything when offered. They're similar to Cina and Chamomilla in this behavior. Again, very capricious. And the child is intentionally very malicious. He will find out your most prized possession, a parent's most prized possession, and try to go and break that thing. Very commonly seen. So even when parents are just about to leave for some occasion, for some gathering, for some function, they will just come and throw a tantrum out of nowhere. Very uncontrollable behavior. And sometimes they even cause a lot of guilt in parents, because of these kinds of behaviors or these kinds of tantrums to spoil the plans. So a TOB child can create havoc in the family. Also, a lot of abusive nature is seen in a child, and a TOB child will do exactly what he is not supposed to do. If you tell him you don't have to do this, he would purposely go and do this to show that, yes, I am a TOB child, and has no control of himself. Even if he does some mistake, even if he throws a tantrum, he doesn't know the cause behind it. This is what TOB is, and can be thought of as a good intercurrent medicine also with your constitutional drug. Yeah. Coming to the next, again, very interesting remedy is Verat Alb. And some of the characters of Verat Alb are very distinctive and very helpful in prescribing this to kids. Overstimulation of mind. Overstimulation of mind is eventually reflected in restlessness of a Verat Alb child, and repetitive behavior is very commonly seen. That is, they would just stack up things, or they will, just take a paper and keep cutting them or tearing them off and making a roll and just throwing around, or they would stack some books or toys. A very repetitive behavior which is seen. So Verat has constant activity, but it does not have so much of violence or aggressiveness like Bell or Stram. And keeps doing activities without any purpose, as I mentioned about stacking cards or stacking chairs or stacking books. And also would like to bring out a point that Verat Alb again have a lot of desire to paint, to sketch, to sing, and they play without any destruction. They would not harm anybody. They would be in their own dhunki, like Mastalagan, own dhunki. They would not cause any harm to other kids. So Verat is very active like Stramonium or Tarentula, but not at all destructive like TUB or Stramonium. They show no emotion when reprimanded, very arrogant and rude at times, and they feign illness to get sympathy from their parents, from their daycare provider, and from their teachers. So let's talk about supportive treatment. These are the drugs that we've run through, the constitutional remedies. I would like to highlight this. This is what I've learned in a seminar. You all can note down these important points. These were again told by Dr. Ram Subramaniam, who is a leading pediatrician in the eastern suburbs of Mumbai. So he says, never 3 C's. So never criticize a child, never condemn a child, and never complain. And always LAA. So always love, always show affection, and always appreciate a child. Mark my words, this has helped me in counseling the parents so much. And the supportive treatment is a must along with your constitutional treatment. So if you would just give this, if you carry this formula with you in a pediatric case, not even pediatric, even in adults, this really helps. Never 3 C's and always LAA. This would really help a long way in tackling patients with a lot of behavioral disorders. So the assessment, a parent's interview for a follow-up is a must. We need to focus on verbal and attention skills of a child, cognitive development of a child, academic performance given by school teachers or the principal, ability to finish off tasks. Very important, because this is a characteristic of ADHD. They cannot finish off their task. And interpersonal relationships with family, teachers, and peers. These are the 6 points of assessing how your remedy is working on an ADHD child. This case taking is a very short case that I have taken, and every doctor has a different way of case taking, but do follow organon and stick to the case taking what Dr. Hahnemann has advised us. Follow Dr. Hahnemann's principles. You will never fail in case taking. This was referred to me by a clinical psychologist in a hospital where I'm attached. I'm attached to Larsen and Toubro Hospital since almost 7 years. And I would like to share this case with you. A very short, brief history that I have taken, because at L&T, I only get 15 minutes for a new case. So I've tried my level best to get all the data compiled and work on the case. Sorry, just a water break. So Master ZK, 4 years old, very restless, cannot sit for more than 1 minute, very anxious, pushes children in school. This behavior was told by the teacher to the mother, and whenever there is a complaint from the school, a mother feels very upset. I think I'm the only mother who doesn't feel upset when I get complaint from my child's school, because I'm a homeopath. Has to be forced to do basic chores like brushing, dressing up. Teacher complained he is inattentive, language development delayed, only speaks Ammi, Abba, and Appa. Ammi is mother, Abba is father, and Appa is sister. And he would express in just 1 or 2 words like khana, pani, sona. Unable to frame sentences. This was taken in July 2018, and details given by mother. Mother was very upset with the school teacher's remarks. Screen time 4 to 5 hours daily, which is too much, which is not good for the eyes. Recurrent cold cough, which was aggravated by change of weather, dust, fried food, cold drinks, and dental caries since 1 year. With the physical generals, his constitution was very lean, thin child, appetite normal, craving for cold drinks 2 marks and salty food 2 marks, nothing that he disliked with food. First, 3 to 4 glasses, but mother had to remind him to drink water. Stools and urine were okay, bowel and bladder movements absolutely okay. Sleep 8 to 9 hours, very refreshing sleep and thermally chilly. In pediatric case taking, mother's history during pregnancy is very important. It stands important till the child turns 6 to 7 years of age. So with this case, the mother had no problem. Only the first trimester, she had a little bit of morning sickness, which is quite common, and a full-term normal delivery with a birth weight of 2.5 kilograms, which is very good for an Indian baby. Milestones: delayed dentition, delayed talking, and anterior fontanel closure at 24 months, which is delayed slightly by 4 to 5 months, when the regular fontanel closure happens at 18 months. Mentals, he loves traveling, loves spending time with his sister, and he misses his father a lot, who works in Dubai. So father visits them 1 year for only 1 month, and he's the happiest during that time. Now, in my case taking, what I write down with pediatric case taking is my observation, and I let the child behave as he is. The moment the mother says, "Shh, sit down, you're at doctor's clinic," I reprimand the mother, saying that no, let the child behave the way he is behaving. Let him be very comfortable, and this would take you to the remedy, believe me. So what I have but what I observed in this child was that the child opened the drawers of examination table, he climbed up the table, he jumped, he picked up my stethoscope, played for a while, and even gave the stethoscope in one piece to me back. It was like a monkey, but I was very happy with his behavior. And what I advised to the mother, to that anxious mother, was relax, calm down, engage your child in some household work. Outdoor play is very, very important for a child. We as children, I remember I used to play around 3 to 4 hours outside. We would wait for that kab 5 bajega and when we'll go out. Nowadays, kids do not get outdoor play. Taking them to the parks, taking them to the beach or a lakeside, wherever you stay, or just in the building compound is very important. A child has to touch nature, has to touch mud, has to get dirty, should pick up dried leaves. If you come to my house, I have a lab over here which is with pebbles, stones, some sand from Juhu Beach, some shells, some dried leaves, and we do art and craft activities. So very important for a child to connect with nature. Let the child splash with colors, give him some crayons to scribble, give him chalk, clay or mud play, sand play. Music therapy is of the utmost importance. Time and again, I would repeat this because I have seen many kids improving with music. And musical instruments would come in kids a little above 5 years of age where they can play musical instrument. It gives a very soothing effect on the behavior, on the mental aspect. So my repertorial analysis, I used complete repertory, very simple and short and sweet case. I took restlessness, travel desire to, food drink, cold drink desires, food salty desires, and dental caries decayed hollow. So I came across Merck, Calcaria, and Calcaria Phos. But coming to the picture of delayed dentition, delayed closure of fontanelles, plus chilliness, and looking at his constitution, I selected Calcaria Phos as a constitutional drug for this child. So in July 2018, I administered 1 dose. In August 2018, patient was SQ very early to see any changes in the behavior. So I repeated 2 doses again, once in 15 days. In September 2000, so at L&T, I have a follow-up every month or every 2 weeks because we have a very heavily filled OPD. We need to see the patient once in 2 weeks or once in a month. So in September 2018, it was a happy day for me because the mother was so happy. She came with a wide smile saying that my child is showing now interest in coloring and sticking activities. He has started expressing khana do. Initially, it was khana, khana, khana. Now he could say khana do, pani chahiye. And at this point, I really appreciated the mother and she felt so happy and the tears in her eyes were a victory for me. I again repeated Calcaria Phos 1 dose. And in October 2018, after a month, as advised, I keep time and again advising parents how to approach, how to start, how to introduce new activities. So the mother started with alphabets and numerals, and his attention span increased to 4 to 5 minutes. So from 1 minute, increasing to 4 to 5 minutes is again a sign of improvement that we need to appreciate. He looked forward to go to the garden for his outdoor activity. He loved doing his coloring activity with his sister. Again, I repeated 1 dose of Calcaria Phos. November 2018 to August 2019, almost 9 months, he showed remarkable improvement. He started framing sentences. He would say, Doctor, Auntie, mujhe meethi goli dijiye. He would say slow, but he would complete the statement. He completed his day-to-day task also. And there was only 1 episode of upper respiratory tract infection, which also settled within 2 days. The mother called me up. I said that if the fever goes above 101, you would give me Calpol, but you can do all, you can try home remedies with the tulsi and haldiwala milk and honey, and it settled within 2 days. There was no need of any antibiotic to be administered to this child. In September 2019, he came up with tinea versicolor, where I gave him Calcaria Phos 2 doses once in a week, thinking that this would help the child. And this is a picture. I would request nobody to take a screenshot of this. This is very important. We need to maintain the patient's confidentiality and privacy. He did not improve much. So in September 2019, I changed to Basilinum 202 doses. My point of repeating was he was supposed to fly back to Dubai with his father. So I had to quickly show an improvement. So I don't know if it's a mistake or if I did work out on the case, but I thought of introducing an intercurrent Basilinum 200, and you see the remarkable improvement in 15 days. And I met his father for the first time because he had come to pick up his wife and his daughter and son. He was overjoyed to see a phenomenal change in his son. And while just leaving, he said that "मैं हमेशा आपको दुआओं में याद रखूंगा." So that was a victory for me, for homeopathy, for our science. So this was just a very simple case that I presented to you, and it takes a couple of months, for improvement to be seen in an ADHD child. Recently, because of lockdown, they haven't been able to fly back to India. But I received a call in the month of March 2020 saying that he is absolutely fine. He is completing his task. He is able to recognize objects, animals, birds, plants, everything. The mother is overwhelmed, even the father. So this was my case, a very short case of Calc Phos. My acknowledgement, what I have read in details is Essentials of Pediatrics by Dr. Praveen Jain, Essence of Materia Medica by George Vitholkas, Alan's keynotes, and a few websites that I've referred to. And last but not the least, it's my favorite when it comes to kids. देखो इन्हें ये है औंस की बूंदे, पत्तों की गोद में आसमां से कूदे, अंगड़ाई ले फिर करवट बदल के, नाजुक से मोदी हंसते फिर से, फिसल न जाए, खो न जाए तारे जमीन पर. Thank you so much. I hope you have taken some good message from me.
Absolutely.
Yes. And this is my Facebook page, and again, in my email address and my phone number also. You can contact me anytime to help with ADHD cases. Yes. Yes.
Wonderful, wonderful. And Dr. Kavita, wonderful presentation. And yes, I think you all can see. आप लोग follow कर सकते हैं Dr. Kavita को Facebook में. Dr. Kavita का Facebook page का नाम है Dr. Kavita as S. Chandramani, and her email ID is drkavita.sc@gmail.com. And इसी में इनका mobile number भी है. That is also there, so you can contact Dr. Kavita. Dr. Kavita, wonderful presentation. I think you have dealt the जो आपने कई सारी बातें की, which are very simple but very effective while dealing with these kind of patients, because they are very special people and they have to be treated in a very lovely way, which you are doing. So I think just one or two questions. Dr. Shweta Bihani is asking why Basilinum. Why Basilinum?
Is my video not working?
Yes, we cannot see you.
1 minute. Oh, I was all the throughout. I was all.
No. We could see you, but I think last 20 minutes. Yes, now.
Minutes, yes.
Okay,
I thought there on the video.
No, your name was coming.
Okay. No problem.
Yes. So the one question that is there from Dr. Shweta, I think I'll just repeat it.
Yeah.
Dr. Shweta Bihani is asking why Basilinum.
Calc Phos 2 doses were administered, and the child did not respond to. And as I said, I don't know if it's a mistake or what, but he had to travel to Dubai, and there were no means that I could wait for more time. So I just repertorized the case again. And as we all know, Basilinum helps with tinea cases. I tried administering Basilinum, and the patient improved just 2 or 3 symptoms. If she wants, I can share my reportorial sheet later when I go to the clinic. I'll be able to.
Sure. Any more questions, audience? You can just type, and Dr. Kavita can answer it. Because Dr. Kavita has to leave also.
Yeah,
Dr. Kavita has some work, so she'll be leaving. But okay, so a lot of doctors are thanking you, Dr. Kavita.
Thank you
and
so
they have
much.
absolutely loved your presentation.
Thank you so
Right.
much.
I especially like that जो आपने 3 C's जो आपने बोले. That point was very correct and very practical and very effective points. Because जो आपने 3 points बोले थे, 3 C's, and there was one more thing, right?
LAA, love,
A,
Yes,
affection, and
LA,
appreciation.
yes.
yes, LA. Wonderful,
Yes.
wonderful. So, Dr. Kavita, thank you so much for joining us. It was wonderful to
Thank
have
you.
you,
Thank
and
you so much.
wonderful to have you. And so we are honored to have you on our platform.
Thank
Just
you
one more.
so much. Yeah.
Can we take one question if that's okay?
Yes. Yes.
Okay, Dr. Chai is asking, can ADHD patients be diagnosed by homeopath, or they require special screening by allopathic experts?
So in my experience, I would always refer to a psychiatrist to get a detailed evaluation of a child. Yes, it can be diagnosed by homeopaths. The slide which showed the symptoms, you can prepare it as a questionnaire,
Okay,
and that would help with the assessment and to diagnose. Yeah.
right.
But I would always recommend that it is a teamwork and an
Hmm.
assessment by a psychologist or psychiatrist. In some cases, a pediatric neurologist is a must. Yeah.
Okay, wonderful, wonderful. So thank you, Dr. Kavita. We'll love to have you back on our platform once again.
Sure, sure. Thank you so much. Thank you.
Right.
Thank you, everyone. Thank you, all participants, to be a part of this. I thank Spondon Drops. I thank Bhargav Phytolab to take up this initiative of iSampark webinar and to get us all close in homeopathy. And my best wishes to you all to flourish in homeopathy and love homeopathy. Okay. Bye, everyone. Have a great
Thank you.
evening. Yes.
Bye.
Thank
Thank
you
you.
so
Bye.
much, ma'am.
Bye, Dr.
Thank you.
Kavita. Thank you. Thank you, everyone who has joined us today. It was wonderful to have you. And Dr. Vishal, Dr. Aniket, Dr. Ganesh, Dr. Fatima, sorry we couldn't take your question because Dr. Kavita had already informed us yesterday that she has one patient to whom she needs to meet at 5 o'clock today. So that is why it was a very short and sweet presentation. So nevertheless, Dr. Fatima, आप regular हैं, so we will take it in the next session. Thank you, audience, for joining us, and we'll be coming up with more webinars very soon. We'll be sharing the details in the WhatsApp group. Just be there with us, and I hope all of you have our numbers. Thank you very much for the excellent session. Thank you, Dr. Lena James. Thank you, very knowledgeable webinar. Thank you. I would request all of you to please come up and आप लोग भी sessions लीजिए. Dr. Mubarak, Dr. Fatima, Dr. Lena, Ashika, Vishal, Aniket. Please, if you can just come up with some good sessions, we will be more than happy to host you. And हमारी जो नई किताब आ रही है होम्योपैथी वर्क्स के नाम से, उसमें प्लीज अपनी केस स्टडी या अपने आर्टिकल्स शेयर करिए ऑन द टॉपिक ऑफ बोन रिलेटेड डिसऑर्डर्स. द बुक नेम इज बोन रिलेटेड डिसऑर्डर्स. टॉपिक है बोन रिलेटेड डिसऑर्डर्स. उस पर अगर आपके पास कोई आर्टिकल है या आपके पास कोई केस स्टडी है, प्लीज शेयर इट विद अस. वी विल बी मोर देन हैप्पी टू publish it.
And in case you want to conduct any webinar on topic which is related to bones or the related disorders, it can be anything, arthritis, osteoporosis, any such topic. If you have, you can get back to us. We would be happy to have you on the webinar as a speaker as well.
Right. Thank you everyone who has joined us. I think you all are there in our WhatsApp group also. See you then there. Thank you. If you want, you can unmute people if somebody has to say something.
I'll do that.
Okay, I have. Somebody has replied, I think. Okay, Dr. Mubarak, I have one more little customer. It's wonderful case. Dr. Mubarak, please, आप ping कर दिए Shmit जी को, and she'll be doing the needful. Dr. Girish Kulkarni, thank you. Thank you. Spondon, thank you. If somebody has to say something, आप लोग unmute कर सकते हैं. Dr. Rita, Venkata, Amren Pratap Singh, Fatima, Sangeeta, Nalini, Dr. Kashmira, Dr. Uma, Setu, Apurva. Thank you. Thank you. I think we'll just end this webinar now. Take care. Bye-bye. Good evening. Ishmeet, you can just end this webinar.
Thank you, everyone. We are ending with the session. See you on 16th. We have a webinar scheduled. We should inform you all in the through WhatsApp group and through direct messages as well. So looking forward to see you on 16th. Meanwhile, happy Independence Day to all of you. Thank you so much. Have a good weekend. Weekend is coming, so enjoy the weekend. Thank you. Bye.